Just thought about making a quick video for people with diabetes to talk about the coronavirus. Hopefully I can provide some help or advice. Right, so all us diabetics, we probably know that we've got weak immunity, sadly. And this will cause a big problem because with that kind of virus, we're more prone to get it and to suffer from it if we do get it. Hopefully not. So any precautions that normal people take, we need to take it more serious. So to start with, we talk about preventions first, which normal people take anyway. Washing hands. Everyone knows that you need to wash your hands, you need to sterilize, you need to sanitize all the time. Whenever you touch anything, you need to have some sort of, I don't know if you can actually find any, but I was going to say some sort of sanitizer, anything like that, but I went to the supermarket and I can't find anything. But any Dettol gel, any sort of wipes, if you don't have it, just normal soap, just go to the bathroom all the time, wash your hand thoroughly. It needs to be done. I know it sounds a bit silly when you do it or when you see someone talking about it and doing it, but trust me, if this is what it takes to prevent such a condition, go for it. Because again, us diabetics, someone told me, by the way, that people get pissed when I say us diabetics. I should say people with diabetes. Well, anyway, these precautions, that one precaution, you see, although it's so simple, but it could save you. It could save us, it could save anyone. And this is after using anything, really, because people think that the virus will only get to you if, let's say, if I've got coronavirus, I need to touch you to get it, or breathe in your face or something like that. No, if I'm touching this phone right here, right now, and you just touch it after, if I'm holding it and you just touch it, you will get it. It's as simple as that. That's why whenever you go out, let's say you go to a supermarket and you just finished your shop, before leaving, I think it's wise to go to the toilet and wash your hands. That's how bad it is. Other stuff like avoiding crowded areas. So again, normal people do this, you need to do it, and you need to take care. You need to actually do it more thoroughly. Avoid going out and mixing up with a lot of people if it's not necessary. So if it's not your job, I think all jobs in UK now, I'm not sure about other countries, they work from home. I don't think anyone's got the guts to travel anyway, so traveling is done. People say that you're not meant to go to the gym. I agree and disagree in the same. I agree actually, because I agree. But I was gonna say I disagree because all the time you can just get a hand sanitizer, and just use it. But actually in the gym you are holding weights and you're holding equipments and machines after people that you don't know what they went through or where did they come from. So yeah, I think it's wise not to even hit the gym right now. And I'm gonna make a video about home workouts in a bit, so that would help. If you have one, and I don't think you can buy one now, it's out of stock everywhere, buy a mask, the N95 mask. N95 mask is the one that people use for the corona. You've got all the other types. I think it could help as well, but the N95 is the one that you need to use. This is, I think, and obviously, all the other precautions that people talk about for normal people, do it, but do it even more thoroughly. Now let's talk about precautions for people with diabetics. Stuff that you use. Let's say I'm a type 1 and I use insulin pens. And that's a very bad example. Don't follow this. I'm saying it's wrong. I never used to change the needle, the insulin pen needle all the time, like before every injection. I never used to change it. Now is the time to do so. You have to do it, because first of all, the more you use the pin, the more blunt it gets, and then that's a problem, because then you're gonna create a wound in your body, which will allow more chance for infection. And this is the whole start of the virus, isn't it? Is that if you get infected, your immunity drops even more, because we already got weak immunity. Infection means weaker immunity, means higher blood sugar, means weaker immunity. We don't want that right now. Not just that, the needle itself, if you use it more than once, because the needle itself, it's from a package, isn't it? A sealed package. If you take that package off, you put it in the pen, and then you use it more than once, and then, it gets involved in an environment where, like, let's say you go out with the pen and it's out of its package, the needle itself could get infected. So it forget you wounding yourself, the actual needle or the actual pin, where you use it for your blood sugar test, this could get infected. So it's very wise to use everything only once, sterile, and then throw it. That's it. This is with the needles, I would say. Just apply it to everything. So whether you're using a needle for the insulin, whether you're using a needle for the pen, for the blood test, whether you're using some sort of, I don't know, pump that I don't know about. I mean, some people I knew, they used to reuse their pump accessory. Yeah. So they used to, it was the AccuCheck Insight, I think, or something. I don't know how they did it, but stop it. Even without the coronavirus, that's just done. Don't do it. Now, as you see, people are like, if you go to a supermarket right now, I don't know where you live, but in England, if you go to a superstore, there is nothing. Or anything that sanitizes, all the food that you could actually store, like pasta and rice and all that, it's gone. All the toilet paper is gone as well. I mean, I'm sure there's stuff that are more important than toilet paper, but yeah. So anyway, people are buying everything. Everything is running out of stock. Now, I think for us diabetics, the most important thing is to get hypo food and drinks. Imagine there's a lockdown in the UK and we don't have any hypo supplies, any sweets or fizzy drinks or sugary snacks or anything. There's going to be a problem. Yeah, that's harsh to say. Some people, they get into a diabetes coma because of being so severely low in sugar and they end up dying. So that's one thing for us. When I went to the supermarket yesterday, I didn't care about food at all, even though I'm a bodybuilder and I should be, eating every few hours and so on. I didn't care. I just went to the sweets section. I bought all the Haribos, bought a lot of drinks, and that's it. That's the most important thing for me. Another thing as well that is similar is the opposite. Let's say you have a severe hyperglycemia and you're out of insulin. What are you going to do? And then everything is closed, lockdown. So be smart. Order your insulin supplies, order your sugar supplies, buy your sugar supplies, order it. Get a lot of Lancets. You need to test your blood sugar all the time. So that was going to be the next thing to say. Is we normally I always say you have to check your blood sugar all the time. Now, with this virus coming up, you want to avoid having unstable blood sugar levels, because with unstable blood sugar levels, you're going to be more prone, again, for your immunity to drop, for an infection, for an infection to happen. You're going to be more prone to getting sick, getting a flu. And if you get a flu, it could get mixed with a coronavirus. You can be self-isolated for just having a flu. So avoiding it from the start is a lot better. You don't want to go through this. Have your ketone strips ready as well. So let's say you are suffering from a lot of hyperglycemia, high blood sugar levels. You want to check for your ketones, because if you've got high ketones in your system, again, it's a problem. You're going to be more prone to issues and complications. So have your ketone strips. If they're high, straight away contact the doctor, contact the hospital. There must be someone to contact for emergency, and speak to them and see what they're going to do, what they're going to advise. What else? I think that's it in terms of supplies. Other stuff is be hydrated all the time. So as diabetics, we need to be hydrated all the time, regardless whether there is a virus or not. Now, with the virus, we need to be hydrated all the time just to flush, for many reasons actually. One of them is, let's say you are having a higher blood sugar in your system. Why do you get so dehydrated before you get diagnosed, and why does it help? Is because when you drink a lot of water, it flushes the sugar in your system and then you pee. That's why every single one of us, don't lie, before we get diagnosed, we were so dehydrated and we used to use the toilet so much. That's why. So from the start, just be hydrated all the time. My advice is 4 liters of water a day. Just have it. And don't have it all at once, of course. You just want to be constantly drinking to refresh and replenish the body from inside. I can't think of anything else, to be honest, diabetes related. But yeah, stay safe. Think diabetes, right? Think about what normal people do. Just do it more thoroughly. But also think diabetes is an extra challenge that we have. In terms of working out and training, and let's say people that I train, for example, I'm going to change all the programs now to be home based, because stay safe.